Annapolis to raise taxes for beer, wine, and spirits by an average of 10 cents a drink. ABC 2 News' Roosevelt Leftwich on the chances that we could see that tax and why it seems likely it's going to pass. Rosie.
Well, Jamie, advocates say they're hopeful that this measure will get passed because without it, they say services for mental health, alcohol addiction, and developmental disability services would be severely hampered. 1 in 5. That's the number of people who advocates say at some point in their lives will have mental health or substance abuse issues. They say community-based services keep people out of state hospitals and homeless shelters and keep them productive. And this rally is to get the state to stop cutting those services and instead fund them.
We're cutting funds everywhere for schools, for mental illness, for homes, for DDA, for everything. If we cut all the funds, what are we going to do with our children that are at home or our young adults that are at home? We're not going to put them back on the street again. It's just not going to happen.
The Sheehan Health and Community Services Act would raise alcohol taxes by $0.10 per drink in the state of Maryland, or roughly $3.30 per liter of alcohol. Bar, restaurant, and liquor store owners say it would cut into their bottom line, raising prices and making people buy less. That, in turn, they say, could cost jobs and actually lower state revenue as people do buy less alcohol. But advocates say the cost of a state with fewer treatment and mental health services would be a lot more.
It's not only the right thing to do from a humane point of view. It's much more economically beneficial. It's a deal for the taxpayer, not just the people who benefit from the services, because services in the community are a lot less expensive than in hospitals.
People who have undergone state-sponsored treatment say it has saved their lives. Many people say the cost of keeping community-based services going, the value of it, far exceeds the cost of incarceration and confinement to state hospitals.
A community mental health center gave me low-cost help with therapy and being able to see a psychiatrist to receive the much-needed meds to keep me well so I can pursue recovery and connect with the community.
Now, advocates say that they think this measure has a good chance of passing because the alcohol tax in Maryland has not been increased since 1955, and taxes on beer and wine have not been raised since the 1970s. And this would raise enough money to maintain current services that are right now being cut in the governor's latest budget. Reporting live, Roosevelt Leftwich, ABC 2 News.